Local COVID-19 updates from the experts. What to know from UT Southwestern.
I'm Dr. John Warner, Executive Vice President for Health System Affairs at UT Southwestern Medical Center. Welcome to this week's episode of UT Southwestern's What to Know. This week, I'd like to explore the topic of heart and brain health and how COVID-19 is affecting the heart and brain health of our community. This is a topic of particular interest to me as I'm a cardiologist and a longtime American Heart Association and American Stroke Association volunteer. In fact, I served as the president of the American Heart Association and the American Stroke Association in 2017 and 2018, and was fortunate enough to travel the world learning about heart attack and heart and stroke care throughout the world. I suspect many of you know that heart disease is the #1 cause of death in America, and stroke is number 5. In fact, 1 out of every 3 Americans dies of heart disease or stroke, and every 40 seconds in America, someone suffers a heart attack or stroke. We also know that during stressful times that the numbers of people having heart attack or stroke goes up. We see this commonly in areas affected by a natural disaster, a hurricane, a flood, something like that affects the health of a community, and we see more people having heart attacks or stroke. We also see it in times of economic strain. We saw it in the Great Depression, and most recently in 2008 during the economic recession in America. Going into the global pandemic, we expected to see more people having heart attacks or stroke. In fact, we saw just the opposite. 40% fewer people seeking help for heart disease, heart attacks, and strokes in our community and across the globe. So today I've invited 2 of my colleagues, experts in heart disease and stroke, to talk with us about heart and brain health in our community and how we can best help those seek medical care who are affected by heart disease or stroke or at risk for heart disease or stroke. Dr. James DeLemos is a cardiologist and directs many of the heart disease and heart attack care programs here at UT Southwestern. He's also the executive editor of Circulation, which is the most prominent cardiovascular journal in the world. So welcome, Dr. DeLemos. I've also invited Dr. Babu Welch, a neurosurgeon and internationally known expert on stroke care, who directs many of the stroke care programs here at UT Southwestern. Welcome, Dr. Welch. So Dr. DeLemos, tell us a little bit about what a heart attack actually is and why it's important to get care quickly.
A heart attack happens when a cholesterol plaque in one of the arteries that feeds blood and oxygen to the heart muscle breaks open and a blood clot forms. And this blood clot deprives heart muscle of necessary oxygen. And if untreated, the heart muscle will die. And it's a medical emergency. We have to get the blocked artery open as fast as possible. We treat patients with blood thinners to hopefully deal with the blood clot, and often with what we call coronary stenting, where we try to open the artery with a balloon catheter and then place a stent to maintain the closed artery in an open position so that the blood flow can continue down the heart.
And so what's the time frame for that needing to occur so that the blood can be restored quickly?
It's an absolute medical emergency where every minute matters. We use the term in cardiology, time is muscle, because in the setting of a complete heart attack where the artery is completely closed, you have a window of just a few hours to save heart muscle. But really, within that 6-hour window where heart muscle may be saved, every minute within that counts. And so people who come into the hospital very early after a heart attack and we get the artery open can have very small heart attacks and do extremely well. Whereas on the flip side, people that delay or come to the hospital late when the heart muscle has been deprived of oxygen for a long time may not recover the damage and have a much higher risk of developing complications or dying from the heart attack.
So Dr. Welch, we say time is muscle for heart attack care. We say time is brain for stroke care. Tell us a little bit about how important it is for stroke patients to get to the hospital quickly.
Yeah, it's perfect following because the brain has followed the heart in a lot of the therapies that we've done, right? So I think when we talk about stroke in the brain, blood either didn't get there or got out. That's why I like to talk to patients about it. And when the blood, the whole point is that the brain, like the heart, is a very time-sensitive organ. Every hour is years off life and billions of neurons that are actually lost when you're losing oxygen to the brain. So very similar to the cardiology world, the neurosurgical and neurological world has gotten better at saying how long do you have and and gotten better at what can we do. And that has changed so much since about 2004, where we can now get patients clot busting medications in the first 3 to 4.5 hours. But we have now been able to, through some of the therapies that we can do, up to 16 to 24 hours out in very selected patients, go in, remove a blood clot. So if the blood was not getting there, remove that blood clot and minimize the damage to the brain. There are times the sooner you get to the hospital, the more chance we have to reverse. The longer, we may not be able to reverse anything, but we can definitely minimize. So time is brain. And you know, if you more medically, time is neurons.
And I assume that's the same thing for bleeding, right? So if you've got a stroke due to bleeding, the sooner you can get to the hospital and treat the bleeding, the better your chance of not only surviving the stroke, but also not having any permanent impairment or disability, right?
Absolutely. Yeah, the bleeding is a different problem because bleeding causes pressure. And so that you're now not looking at losing brain because of low blood flow, but you're losing brain because of pressure that's created in that box that we call the skull. And so our ability to get there, minimize the pressure, operate if necessary, all of that is very time sensitive.
So we're seeing in some areas 40% fewer people seeking care for heart attacks and stroke. Why do you think that is, Dr. Welch?
A very common scenario for us is husband or younger child is spending time with a loved one, sees what's going on, and says, you should go. A lot of times the patient, their brain is hurt, their brain is injured. The patient's ability to say, I should go is impaired. So that relationship and saying you should go to the hospital, we're losing that a little bit if we're not taking advantage of some of the technology we have.
So it's really a casualty of the social distancing we're doing. We're not close enough to people to know they're in trouble. Dr. DeLemos, are you seeing similar things in heart patients?
We have. It's been remarkable, and it's been unbelievably consistent, throughout the world, where rates of presentation to the hospital with heart attacks have been down by, as you mentioned, 40% or so. And what's interesting is that's been the case in parts of the world and cities in the United States that have been devastated by COVID, but also in places like Dallas, where there's been substantial COVID, but not the same level of devastation, for example, as in New York. And I think, we inadvertently sent a message to stay away at the beginning of the pandemic because we were worried about the safety of patients coming to the hospital. We were worried about having the resources to take care of the COVID patients. And maybe as a downstream result, patients stayed away when they shouldn't have. And what we're seeing is not just, it's not that heart attacks and strokes aren't happening. It's that people aren't coming to the hospital in a timely way when they're happening. And so what you see is people, when they coming in later with more advanced heart attacks and strokes, or not coming in at all, and higher rates of death at home, unfortunately. There's been a clear signal for sudden death at home, which we think is probably because some patients have avoided coming to the hospital for things that they would have previously come to the hospital for.
So this is exactly the opposite of what we expected, right? Typically, when a country, a world is under stress, we see higher rates of stroke or heart attack. So why is that? What about stress makes you more likely to have a heart attack or stroke?
Stress causes the body to release adrenaline hormone, the flight or fight reflex that we all have. And those stress hormones can, for example, raise your heart rate and your blood pressure, which puts excess demand on the heart. They can also increase the likelihood that one of those cholesterol plaques may break open and rupture and lead to the blood clot that forms. There's also some unusual forms of heart attack that happen under acutely stressful circumstances that we're seeing actually more commonly in COVID that happen without even a blood clot. So there's a bunch of different mechanisms by which acute or chronic stress may lead to different kinds of heart attacks.
So Dr. Welch, we initially thought of this as purely a disease of the lung, right? COVID is a lung disease, a lung problem, but we're also seeing rates of stroke that are increased during the COVID pandemic. And tell us a little bit about what you're seeing in terms of coronavirus and the brain.
So, there's been a lot of overlap, and I think where we need to relate the two is the inflammatory process that occurs. And there are different reports of younger patients now having stroke. Most of that you've seen Northeast, New York, Connecticut. We're seeing some of that information from Germany as well. When we've looked at why, what we do see is some of the markers for inflammation are up. That's not to say that a patient's clotting easier because of a hereditary problem, but because the overall inflammation of the system is up, we're concerned. But the converse to that is there's also some literature talking about aspirin or ibuprofen more specifically, which is an anti-inflammatory, also not helping with COVID symptoms or exacerbating. So when you've got inflammation on one side and anti-inflammatory is not so good on the other side, we're still figuring that out. I think generally speaking, if we bring these concepts together, blood pressure's up, inflammation's up, all of those are really good, starters for heart attack and stroke.
And James, tell us a little bit about what heart patients should be expecting should they get coronavirus. What kind of symptoms are we seeing and problems are we seeing with coronavirus in the heart?
Yeah, great question, John. There's sort of two aspects to this. The first is that the manifestations of COVID, even in the lungs and in the hospital, seem to be much worse in people that have pre-existing heart disease. So people that have had prior heart attacks or stents or bypass surgery or who have weak heart muscles need to be alert that if they do get COVID, they're at higher risk for complications, and so need to stay in much closer contact with their physicians and are more likely to be hospitalized and need more intensive care than people without prior cardiac disease. The second piece of that, though, is there are some emerging unique heart complications of COVID that we wouldn't have expected. And some of those really link to what Dr. Welch was talking about with stroke. There's an unexpected propensity for blood clots in COVID that happen really throughout the body. We're seeing lots of blood clots in the legs and the lungs. We call the lung clots pulmonary embolism. We're even seeing clots in various chambers of the hearts that we wouldn't have expected. So you see a spectrum of blood clotting disorders that seems to be more than what you see with other respiratory illnesses like influenza. And so there's a lot of interest in more aggressive blood thinning for preventing blood clots in the COVID patients. And we're certainly doing this in our hospitals now, and there's a lot of research going on in that dimension.
So throughout this whole pandemic, we've all been sort of learning on the fly. And I know you've led this registry of heart patients that have had COVID across the country and across the world. Tell us a little bit about that registry and what we're learning from it.
Well, I couldn't agree more, John, that there's this absolute unprecedented pressing need to learn about this disease and how we can do better for our patients and for the community. And what we realized quickly was that the research that was coming out was limited because it was anecdotal, coming from a single hospital or center, and so not really able to be generalized, across cities, states, countries. And so building off of work that was done at UT Southwestern and in partnership with the American Heart Association, really, we were able to leverage the American Heart Association resources to stand up very quickly a COVID registry in hospitalized patients focusing on cardiovascular complications. And the goal here is to rapidly learn and disseminate knowledge and actually improve the care of COVID patients. We've got well over 100 hospitals within 3 weeks who've registered and 2,000 plus patient records entered, which is probably only a tenth of where we'll eventually be. So we're rapidly accumulating information. We're seeing tremendous ethnic diversity already with overrepresentation of hospitalized COVID among individuals who are socioeconomically disadvantaged or from underrepresented minority groups. Hispanics and African Americans are dramatically overrepresented in the registry, which I think many people have heard that the pandemic seems to be disproportionately affecting these individuals, and we're seeing that in the registry. So I think we're going to be in a position really with work growing out of UT Southwestern to make important advances in the nation's understanding of the pandemic.
And Dr. DeLemos, if you're a patient or you're a person at home and you think you might be having symptoms of a heart attack or stroke, what should you do?
Call 911. Our hospitals are safe. We're prepared to give you the very best care. We've learned how to take care of regular medical conditions, including medical emergencies in the context of the pandemic, and don't delay. I think that's the key message, is that it's time for us to put that fear of coming to the doctor and the hospital away, because we may lose more people and have more downstream effects from not coming in for things that we previously had taken care of when patients aren't coming in. So I think that's the big message, is that it's safe in the hospital. If you have discomfort in your chest or new severe shortness of breath that make you think that you might be having a heart problem, call 911. The paramedics will treat you safely. They will not expose you. We'll take care of you in our hospitals safely, and we are well prepared, even in the context of the ongoing COVID cases, to give you the best level of care. And that's what you need, because sitting this out at home is not the right answer if you're having symptoms.
So that's just as important for stroke care, right, Dr. Welch?
It is. I'd like to echo, I mean, heart attack and stroke are very similar when it comes to the emergency level. And I think what both the emergency medical system, if we say EMS, those groups have really been well educated in how to take care of these diseases in the field at your home. I think when we kind of tie back to some of the disadvantaged communities, a lot of the idea is, well, they're not going to come to our neighborhood. They need to, and they will. Make sure that you make that phone call in a timely fashion. Time is brain, time is heart. Making sure that the EMS facility providers who are very well educated in both COVID and also the management of stroke and heart attack. You can stop damage and you can start healing by just dialing the number, recognize the symptoms and dial a number, and then come to the hospital. That's what we do. That's what they do.
So Dr. DeLemos, as we enter the Memorial Day holiday weekend, we're seeing loosening of restrictions on things that we were prohibited from doing over the last couple of months. We can go to more restaurants now. We can go to more retail stores. We can be together a bit more. How are you and your family thinking about that and keeping yourself and your family safe?
Yeah, I mean, we're thinking about a gradual return to normal, very slow, because just because things are opening up doesn't mean that COVID risk is down. And the way I tell my teenage son is it's all about your exposure risk, and so it's unrealistic for me to think that he will not do any social activities for the duration of the summer. But if he modifies those with fewer individuals, more space between them, and shorter social interactions, then he has less time to be exposed to somebody who may have the virus. And I think that's sort of what we're doing. We're not, we're pragmatic, so we're not, I have to go to work, and I have a great regimen where I make sure I do my best not to bring, any contamination from work into my home. And then when I'm home, I lead as normal life at home as I can with my family. But then, I think increasingly we will, begin to reemerge, but in small doses and for short periods. And it won't be back to normal anytime soon for us.
And how about you, Dr. Welch? How are you keeping your family safe, and what are you telling your patients?
I speak a little Spanish, and one of the words I like to use is aprovechamos, right? We are enjoying some time together that helps with the stress that James talked about. I think a lot of people are going to want to get out there and de-stress all together in large communities, and we're trying to minimize that. I'm fortunate that I don't have teenagers that I have to take the keys from. I got a 10 and a 7-year-old. So, but talking to them about what disease is, and how we can, spend time together, but also interact with friends. My patients, I tell the same thing: know what your risks are, know how your health is, take advantage of some of this time to make that health better, right? And then learn from what we did here to kind of move into your life. We all have said things are going to change. Let's make them change for the better.
So as we head into this holiday weekend, where many of you will be spending more time with friends and family than you have been in weeks and months, we hope you will take the lessons that you learned from this program and apply them to your own personal health and to the lives of your family. Things are opening up. We want to remind you to stay safe and stay healthy, and above all, enjoy the time this weekend.